Hello, my name is Ian Kratzke, and I'm pleased to share our recent study published in the Journal of the American College of Surgeons, which examined the current state of formal curricula to teach general surgery residents about healthcare disparities. Healthcare disparities encompass a broad range of factors that contribute to differences in how patients access, receive, and benefit from healthcare. Some examples of these patient factors include race, income, and gender. Over the last decade, there's been an increased recognition in how these patient factors can influence their care. Additionally, with the recent increase in public attention on social inequities, there's a growing societal emphasis to better address healthcare disparities. One aspect of this is in training physicians to better understand this topic. In terms of educational expectations for general surgery residents, some aspects of healthcare disparities, such as cultural competency, are now included as part of the training milestones, but there is still limited curricula available for surgical residents to learn about this topic. Therefore, our study aimed to investigate the current state of healthcare disparities curricula within general surgery training programs in the United States. After approval from our local IRB and the APDS listserv, we surveyed all general surgery program directors to identify whether they had a formal curricula relating to healthcare disparities. Using multiple choice and free text items, we asked PDs to describe the design and content of existing curricula or to describe the reasons for not having one at their program. We also performed a similar survey at our institution of general surgery residents, which served as a local needs assessment to implement a curriculum here. 146 program directors responded to our survey for a response rate close to 50%. And of those respondents, 47% indicated an active healthcare disparities curriculum. Most of these were only recently implemented. Here you see the most commonly taught topics relating to healthcare disparities include patients' race and gender, socioeconomic status, and culture. Most curricula were taught using in-person didactics and web-based tools. Conversely, more than half of the programs report not having a formal curriculum relating to healthcare disparities, and some PDs even stated that there would be no benefit to having such a curriculum at their program. Some of the most common reasons for not having a curriculum were due to a lack of time or not having the faculty able to teach about this topic. For our local needs assessment, 30% of the residents responded. We found that our residents desire similar topics to those that are commonly taught nationally. However, they prefer small group discussions as the primary teaching method. And importantly, all the residents stated that they prefer gaining practical knowledge on how to address healthcare disparities rather than learning about national data or expert opinion. So in summary, almost half of the general surgery programs formally teach residents about healthcare disparities, with most only recently implementing these curricula, yet many programs still do not have any formal education about this topic. At our institution, at least, residents want to learn practical knowledge about this topic. As more programs begin to incorporate this topic into resident education, additional resources may be useful for implementing successful curricula. Thank you for your time and interest in our study.